I'm at Prince Court Medical Center about to get a comprehensive medical exam and take you with me through this process. Stay tuned.
It's time for my annual health exam, and I heard great things about Prince Court Medical Center medical tourism health screening packages. I was able to go online and review their packages based on age, and they list the dates of availability. I booked my appointment online. You can also contact them on WhatsApp if you have any questions. It's a modern first-class facility. It's conveniently located in KLCC, close to the pavilion. The staff speaks English. When you book your appointment, you will receive an email saying your registration has been received. Then they'll follow up with another email to let you know that your appointment has been confirmed and give you the instructions on where to meet and any specific guidelines to follow.
Let me do this now. Y'all don't be like me and forget your passport, but I have a passport card which is valid, and I always keep a copy of my passport in my files on my phone. I completed the registration form, which is basic information. You submit it and you wait for them to call your name. It's that time of the year for my annual exams, and Malaysia is known for their medical tourism. They're in the top 7, and I'm here, so I decided to get a comprehensive medical exam, which includes my well woman exam, ophthalmology, blood work, mammogram, and some other tests. I'll get into those later. No matter where I am, I'm trying to stay on top of my health. Very important.
This is a list of the health screening packages with the prices based on age and what it entails.
They just called me up to explain the process, that I have a morning appointment. They do your exams. It's about a 4-hour process because I got to do a stress test. I get diet counseling. It's explained very well. And I told her about the diet counseling. I'm like, Rody boy got me hemmed up. Your test results are given to you later in the afternoon with the doctor consultation. Well woman exam is sent to you later in the week. That's normal. But all the other exams, like the stress test, the mammogram, the blood work, ophthalmology, is given to you same day.
As you can see, the waiting room is empty. They did a great job processing people through, and I didn't feel like a herd of cattle.
I had to fast for the blood work, so I'm sitting up here hungry, and I don't even eat early in the morning. That's because I'm up, and I know I haven't had anything, or I can't eat that I want to eat. You start with a rotation of services. I go get my blood pressure and the eye exam. Then the next station is the hearing test. Then I go get the weight and the body fat done, and after that I went to go get my blood work and urine tests, and now I'm sitting waiting to speak with the doctor. Waiting to speak with the doctor has been about 45 minutes, but it's a 4-hour process. The wait is comfortable, the room is nice, it's not overcrowded, and it's been a smooth process. Can't eat food yet, so no food.
In the waiting room, there's coffee, tea, snacks, water. They make it very comfortable while you wait.
They give you a lunch voucher, which is nice, and that's 10 ringgits. Right when I made that video, they came out and got me. So it's about a 45 to 50 minute wait to see the doctor. They apologized for the wait, which was fine. And I had my breast examination, not the mammogram, that's in radiology, and a pap smear, which comes with the package that I have. Everything is going well. Now I'm off to radiology to get my mammogram and other services. I'll let you all later.
If you're new here, I'm Shawn, Queen of DC, a full-time solo traveler, sharing my travel tips and adventures around the world. If that's your vibe, subscribe.
Now I'm headed to get my chest x-ray. they give you a top cover and then you get a roll. So let's go. Going for my chest x-rays. The chest x-ray is done. Now it's time for my ultrasound, but they want a full belly, so I have to drink some water. I just completed my bone density test. That was the first time for me. They use a machine. It's almost like an x-ray machine. And next is my mammogram. They're giving me time to drink water and feel my stomach for my ultrasound. It's going well. I had my mammogram. It's all moving pretty fast and smoothly. Now it's time for my ultrasound. I'm in my little row, about to get my ultrasound, but everything is moving smoothly and efficiently. Okay, so I finished in radiology. I had my ultrasound, and he said, "Oh," and I'm like, "Wait a minute, what's going on?" He was like, No, it's all good. I was just trying to see your full kidney, and I couldn't see it at the time. I was like, "Okay, check it all out. Check it all out." All right, so I'm headed back to screening. I have my ophthalmology appointment after this, and it's a great process. Everyone, the staff is nice and explain anything you need explained to you. All right, let's go get my next test done. Okay, y'all, I just did the stress test where they hook you up to the machine and this little box with all the wires, and then you get on the treadmill. I completed that. Now I'm off to see the ophthalmology department on the 3rd floor, and then the diet consultation. Lord have mercy. Whatever. It is what it is. I'm enjoying myself with this delicious Malaysian food. All right, check back in later. Going this way. They give you a slip of where you need to be, so I go this way. You have the directions on that slip. Lovely hospital, medical center. Let's go. I am pleased with the process and the care. It's been an efficient process and rotation. So I go back to speak with the doctor at 3:15. That's the time they gave me. And they'll discuss all of my test results. For the eye exam, they do a scan of your nerves. So they do 2 different nerve scans. And in that room, you are with other patients because there's 4 stations set up. Then they send those results to the doctor. And now I am off to get me some lunch because I'm hungry. And I have been here since 10 o'clock. My appointment was at 10:30, but it's going well. All right, let's go eat. And you get a food voucher for 10 ringgits. My food voucher. 10 ringgits is $2.10 USD. Let's see what I can get from a total of 10 ringgits. I decided to take the stairs, give me some exercise in. All right, headed to the cafeteria. Okay. Looks like these are the places to get food. All right, come through. There's the ATM. You place your order through the barcode, and I didn't want any chicken. I didn't want any rice. I'm going to try their fish and chips. As I mentioned, the process is efficient. I don't think you get enough time in between for lunch. I'm struggling with it, maybe because it took me longer to put on, take off my clothes, or the wait time was a little bit longer. But for lunch, you can do it at any time. It's just that it's a long day without eating because I was fasting. So I don't want to wait anymore. I guess I could have gotten a snack, but it's kind of pushing me close to my consultation time. I want to be on time, and I think it didn't give me enough time to eat. We'll work it out. We'll see what happens. Ooh, y'all, That looks good. I got some peas, some coleslaw, fish, and chips. Some ketchup. All right, let me get in here and dig in because I got to go to my diet consultation. Let's get it. This is hot and fresh. Woo. All right. Okay, y'all, my comprehensive exam ended at 4:45 p.m. Started at 10:30, ended at 4:45, and you get a bag with your comprehensive report on the inside. I do have some tips for you that will be very helpful, and one big one coming up. In your packet, you get a disc with your radiology exams. There's 2 in there. Free coupon, and over on this side, you got your packet of information you can refer back to and take with you to your next doctor's appointment. Very nice comprehensive health package. The diet consultation was excellent because she went over my blood panel and explained the numbers to me and what it represented, what I need to improve. I appreciated that consultation. I was scared to go thinking it was going to talk about just diet, but it was my blood panel. And I went back to have my consultation with the doctor. She also went over my labs and other issues, and I told her that they didn't take my eye pressure when I did the ophthalmology exam, and she said they told me they would, but I went back, they did the pressure, and that was very important. Now, when you go and get these exams, it says ophthalmic testing. I assumed that it included pressure and maybe a scan of your eye to see the nerves. The nerves scan they did, but the pressure they didn't. And the pressure is just as important for me. So when you book your appointment, make sure you ask them what that ophthalmic testing includes. That way you'll know. Here's another big tip. I had no idea that when it's time to pay at the end of your service, you get 10% off if you use MasterCard. Well, of course, I didn't have my MasterCard with me. I left it. Had I known, I would have brought my MasterCard with me. They do accept Visa and American Express, but you do not get a discount with those cards, only with MasterCard. So, I was pouting, frowning, sat there about an hour trying to figure out how I can get my MasterCard. I didn't get the discount, but I got another chance to see the doctor, and she was wonderful. Dr. Nora, bedside manner, very attentive, caring, listening, and she went the extra mile for me, and I appreciate that. So be sure to bring your MasterCard if you want a 10% discount when you pay for your package. I've taken you all through the process with me, step by step. Overall, I'm very pleased with the service. The professionalism of the staff and the doctor was excellent. State-of-the-art equipment. Also, the doctor, when I was talking with her, stressing the importance of getting that eye pressure test, she made sure to resolve the issue and give me the test that I needed done. Even though it wasn't part of the comprehensive package, they added it on, which was fine with me. I just needed the test done. That was key for me in that exam. And she heard me and she did something about it. So I really appreciate that aspect of them listening. I would return. I highly recommend. It's very comfortable, very efficient, because you don't want to go someplace sitting all day, wasting your time. But everything was on schedule, on track, and it's been a long day, so that's why I may not be as chipper as I normally am. It's all good. I highly recommend. All right, peace out. And then I ain't get my 10%, so I'm mad about that. Next time, bring my MasterCard. Just keep my MasterCard on me. I had no idea. I didn't even see it in the literature. I made my appointment online, and maybe it was printed someplace. I don't know. I didn't see it, or I didn't get a message about it, because I definitely would have had my MasterCard with me. The comprehensive health care packages range from $125 on up to $500. Mine was $451. I guess I had some add-ons onto mine. Of course I did. But anyway, I'm happy with the service. There are other hospitals with medical tourism healthcare packages. This is the one I went with. It worked for me, but you can price check the different packages at the different medical centers. My blood work showed that I'm allergic to something. Of course, I figured that with my eyes swelling up and my nose and my ears and throat itching. Oh my God. I know I'm allergic to something in Malaysia. Not sure what it is. I hope you gained value from this video. If you have any questions, leave me a comment below. Be sure to subscribe, like, and share. Until next time, y'all.